Ladies and gentlemen, this paper is in collaboration with researchers from Universidad de las Fuerzas Armadas ESPE, Universidad Central del Ecuador, and Universidad de Salamanca, Spain. I'm Alexandra Zapata, and I'm going to talk briefly about this study. It is well known that since March last year, our country started with lockdowns due to the pandemic COVID-19. It is important to notice that not only the medical area has experienced profound transformations, but also different sectors, among them special education. Therefore, in this context, virtual classes replace classrooms, which challenge teachers to develop and improve computer skills, emerging in this way new working conditions to cope with. So, different work risks appear affecting teachers' well-being. Then, the lack of studies about this work risk made us, researchers, express and share our concern about identifying the factors that contribute to teachers' burnout, leading us to work on this study, which aimed at analyzing teachers' working conditions, determining teachers' health problems, establishing the complementary activities that affect male and female teachers. For instance, the literature review focuses on having a broad view of the situation of education in the context of pandemic, also to obtain information about the COVID-19 pandemic and education in Ecuador, also to find out about problems presented in the new way of working during the COVID-19 pandemic, as well as to obtain information about workspace and health problems related to home office.
This is a quantitative study with a stratified descriptive approach based on a structured survey applied to 843 teachers who belong to different educational levels, such as preschool, primary, secondary, technological, and university. The questionnaire included 65 questions divided into different sections according to difference of importance. The survey was sent through different means, such as social networks, emails, and formal letters to various institutions. Finally, the analysis was done using the statistical software SPSS. Now, we are going to show you the main findings according to the description of the questionnaire. Female teachers, 74%, work in different high schools, and they consider themselves mestizos. 47% teachers are married and 32.6% single. 52.6% are from Pichincha, 8.2% belong to Cotopaxi, and 6.8% live in Guayas. 7 out of 10 teachers work in public establishments and 2 out of 10 in private. 6 out of 10 teachers have a third-level degree and 4 out of 10 fourth-level degree. 9 out of 10 teachers have full-time job position. 58.6% of teachers have a permanent job and 26.6% have a work contract. 4 out of 10 teachers surveyed have a fourth-level university degree. 6 out of 10 teachers have a third-level academic degree undergraduate. 51 work in primary level educational levels and 37 at the secondary level. Now we are going to talk about the main findings related to the factors that contribute teachers' burnout in Ecuador. According to the work environment, we could find that 5 out of 10 teachers totally agree that the schedule is non-defined because they have permanent requirements. Similar findings are mentioned in the literature review. In the same way, 3 of 10 teachers agreed that they don't have enough time to do all the work activities. Besides, 3 out of 10 teachers are neutral, neither agree, neither disagree, considering that they are under extreme pressure by the supervisors. However, almost the same quantity, 3 out of 10 agree about being under high pressure by their supervisors. Additionally, 4 out of 10 teachers responded that online work is more extensive and complex. Finally, 4 out of 10 consider that the activities they develop in the online system demand more concentration and time than the one that is face to face. Now we're going to talk about the workspace conditions. Related to the workspace conditions where teachers develop their activities, around 88% out of 100 teachers claim that the electrical service is efficient. In a lower portion, 74 out of 10 teachers express that they have an exclusive place to work. Likewise, around 85 out of 10 teachers claim that the light they have in their workplace is good. Also, 71 out of 10 teachers point out that the temperature of the workplace is adequate. Regarding workplace ventilation, 83% of teachers consider that it is sufficient. Finally, 97% of teachers have internet service in their workplace, but 42.3 consider this service acceptable and 30.6 think it is not good. Additionally, 5 out of 10 teachers use laptops and cell phones. Nevertheless, 2 out of 10 work only with laptops. Let's talk about health effects. According to the results, teachers have felt or feel one or more ailments during and after their online work hours. In this sense, considering the multiple responses of those surveyed, it has been determined that at least 38.2% of teachers have suffered from neck pain. In addition, about 32% of teachers have one or more ailments similar to those of carpal tunnel syndrome, numbness, tingling, weakness, or muscle damage in hand and fingers. Likewise, about 17% have suffered from some gastrointestinal disorders. To a lesser extent, approximately 8% of teachers have suffered from all the possible ailments generated by the online work modality, such as ailments similar to the carpal tunnel syndrome, neck pain, back pain, technology stress, eye strain, headache, gastrointestinal disease.
Share the findings obtained in order to have a wider view. We focused our investigation on complementary activities. We can explain them as the ones carried out during their working hours. It can be noted that 60 out of 100 teachers, in addition to their workload, have to control the activities of their children. Similar numbers we can find in the studies given by COBA, where they obtained 5 out of 10 women carry out those activities compared to only 1 in 10 men. In complement, we also focused on the household chores. Likewise, approximately 97 out of 100 teachers have to carry out daily household chores, from which 7 out of 10 are women. This shows that women are still the main responsible for the tasks traditionally linked to housework, such as cleaning, taking care of clothes, or preparing meals, while the role of men in this task is secondary, at least in the time taken to perform them. Also, in Chat 4, we would like to explain which are those extra activities, which are the ones called or given extra activities assigned by their superiors. In the case of women, 4 out of 10 have to carry out additional activities, and around 2 out of 10 were men, which shows inequality between men and women in relation to the workload. Finally, we consider it important to know what about the teacher's feeling in order to coming back to face-to-face classes. In that question, we could collect that the 69.2% of them are willing or wanted to come back to face classes. In that universe, the 49.7% are female, while the 19.3 are male in that discussion. Based on that analysis, we'd like to present our conclusions. First, the teachers' working condition changed during the pandemic. Their current schedules became undefined because they had permanent requirements and extra work that took more time than usual. It is notorious that the workspace conditions were a positive aspect of the online system. It is essential to highlight that a high percentage of teachers had an exclusive place to work with good ventilation and appropriate light. The data revealed that women's situation worsened during the pandemic because they developed extra work activities and household tasks, such as cleaning, preparing meals, controlling, and guiding their children's activities. Despite the advantages that the online work represents, most of the teachers wanted to return to on-site classes, and this desire was stronger in women than men. This research has identified the main factors affecting the teachers' burnout during the COVID-19 pandemic in the Ecuadorian context and has given insights for future studies related to women's teachers' new working conditions. Would like to share the references we followed in our study. Thank you very much for all the attention